Hey everybody, this is Dr. Paul Thomas with Plum Health DPC, and today I'm joined by...
Dr. Raquel Orlick. I'm the newest doctor here with Plum Health.
Awesome. And today we're talking about procedures. So a lot of people need small procedures, and it's on a sometimes annual or every 3 years basis, and sometimes they come up by surprise. So like, for example, laceration repair. If you cut your hand, that's never a great thing to happen, and it's nice to know that you have a doctor on call that could sew it up for you. And that's something that we offer at Plum Health. What kind of procedures have you seen recently?
We've seen definitely some laceration or small cut repairs in the office. Some of the more fun procedures sometimes we get to see are some of the small skin procedures, the biopsies. We had some cysts that we were able to drain in the office. Those are always some great procedures. Definitely all of our patients are really happy when we were able to take care of it and save them a lot of money than sending them over to potentially a specialist to get it done.
Yeah, because typically if you go to a dermatologist or even a primary care physician, like a family doc who bills insurance, the charges could be $150 to $500 for the procedure, depending on if it's performed by a generalist or a specialist. And then if it's sent to pathology, you might get a second or third bill in the mail like a few months later for the pathology charge, right? So we try to make those charges really clear from the start that, if we do send something to pathology, it's around $70 for a biopsy. And then if we're doing a pap smear, it's $33.
Something that you'll see from our blog post from today is cerumen impaction. So a lot of people will come in, they'll have fully occluded ears with earwax, and we can take that out in the office for no charge. And our patients are very happy when that's taken care of.
Yeah, yesterday that happened where a gentleman came in and he couldn't hear anything out of his right ear. So I had him come in and examined, and it turned out that it was fully blocked with wax. So we tried to take it out with a little, what's called a cerumen spoon or a Sarah spoon, and that didn't do anything. So we used an elephant flush, which is just like a squirt bottle with a tube on it, and I flushed all that earwax out, and he said that his hearing was back to 100%. So that was pretty fun to do that in the office, and really good for him. He contacted me that morning. I saw him that afternoon, and he's walking out with his issue resolved at no charge. So that's pretty important.
Yeah.
Talk about some of the lesions that you might want to biopsy. Like, what would be a concerning lesion for you?
Yeah, so, as we age, we are at an increased risk of developing skin cancer, especially if you're fair-skinned. Things that we're looking for are new changes in potentially a mole or maybe some type of scab that doesn't heal over a long period of time.
Yeah.
Usually we use the ABCDEs of skin changes.
What is that?
So A is asymmetry. So if you notice that potentially a mole has some asymmetry to it, so it's not symmetrical looking.
Yeah.
B, if the borders seem to be a little bit unusual as well, it's not a smooth border. C, the circumference or the color, the color. So if you start seeing some changes in color, sometimes especially very black, discolored moles can be concerning for one of the more concerning skin cancers called melanoma. And then D is diameter. So if the lesion or the mole continues to increase in size, that would be, and usually we have cutoff marks where we would be more concerned about the mole getting bigger. And then lastly, the E stands for evolving. So if it's changing over time, we might have a mole that we've had for 20 years and it hasn't changed. It's less concerning than something that's growing rapidly.
Yeah. Yeah, usually my cutoff for size for the D, the diameter, would be like 1 centimeter. If it's bigger than that, and you can think of that as maybe the width of your finger, it's roughly 1 centimeter. So if it's larger than the width of your finger, then it's something you'd probably want to have looked at. And then with color, some color can be like variegated, so it can be really dark in one spot and lighter brown in another area. That would be more concerning than if it's consistent throughout.
Right. And then other than those type of changes, something that just isn't healing, you've tried to put maybe some over-the-counter ointments on it and it's continuing to either drain or it's itching, potentially, it's intensely painful, bleeding. Those would be all the reasons that you might want to get it checked out. And we can do the biopsy in-house and then send it out.
Yep, and usually we get the result back within a week. So usually about 7 days we tell folks, but sometimes it'll be like 5 or 6 days that it comes back. And so if you're worried about a lesion on your skin, now might be a good time to get it taken care of because, we can do the biopsy, we get the results back in a week, and it costs you $70 to get it done. So there's really no excuse not to have it looked at if it is concerning you. I wanted to mention some of the other free procedures that we do for our members. If you're a member, you can have an EKG done at no charge in our office. You can also have pulmonary function testing done in our office at no charge. A couple weeks ago, I removed an ingrown toenail, also at no charge for our patient. I remove warts.
Yeah.
We use what's called stat freeze, like a cryotherapy, and apply it to the wart. And sometimes that can decrease the size and appearance of the warts. So there's a lot that we can do with a handful of tools that we keep in our office. And we do this because it provides a lot of value for our patients and saves people a lot of money, and is also good for their health. It's good to have your pap smear every 3 years if that's indicated. It's good to have these moles checked out if you're concerned about them. Any closing thoughts?
No, I just think that especially how much that some of the procedures may cost, it's definitely something that we can offer you in the office. We could save you at least a few $100s, if not more, for some of the small in-house procedures at no cost to you, just for being a member here with at Plum Health.
Yeah, something we love to do because we do try to look out for our patients' best interest, and having low-cost procedures is one of the ways that we do that. So thank you so much for watching, and if you have any questions, don't hesitate to reach out. You can call us 313-444-5630 or drop us an email. Mine's paul@plumhealthdpc.com, and Dr. Raquel is raquel@plumhealthdpc.com. So thanks again for watching, and have a great day.
Have a great day, guys.